Thank you for staying with us on the AM show. Now, we talk vaccinations. At least 1.1 billion doses of coronavirus vaccines have been administered around the world. Data from 218 locations show. Currently, 7 coronavirus vaccines are now in use in at least one country. Notably, Israel has been the fastest to roll out inoculations. Now, what was the Israeli COVID-19 vaccination story as of the 3rd of May? I'll tell you. Total doses per 100 residents, 115.6%. Of population vaccinated, 59.7%. Fully vaccinated, 55.9%. And total doses given, 10.5 million. Now, mind you, Israel has a total population of 8.7 million. It gives you a picture of what this country has been doing and getting right. Now, joining us for the discussion so that we can actually get into the Israeli situation and learn what we can from them is Dr. Asher Salmon. He is Director, Department of International Relations at Israel's Ministry of Health. Dr. Salmon, I think it's fitting to say good morning. I know Israel is 3 hours ahead of us, so good morning to you, Dr. Salmon. Dr. Salmon, please unmute.
I'm in Israel.
Great. So it's a pleasure having you. Now, let's kickstart the conversation by finding out what the journey has been since 2020 when, COVID-19 hit, then since December that you've been vaccinating till now. What has been the vaccination story as far as Israel is concerned?
Well, it has to do with meticulous planning, negotiating at time with the companies, governmental commitment, full commitment, meaning Prime Minister being personally involved in negotiations and initiations of this type of contracts. And then, of course, preparing the public by good media campaign, public diplomacy, and tackling worries and certainly tackling anti-vax ideas.
Now, leaders have been crucial in the fight against COVID-19. What has been the specific role that you would say Benjamin Netanyahu has played in ensuring that Israel has got to this point?
Well, he was personally involved in the negotiation with the company, not, dealing with technical issues, but certainly bringing to the table the most senior partners from the other side and putting it very clear that the country is fully committed to do whatever is needed to be able to vaccinate as soon as possible. You have to understand that it's not only purchasing, the companies also want the confidence that you are well prepared, that you have syringes and vials, that you have a clear strategy of how to vaccinate the population, and you know how to collect the adverse events and other efficacy points, which are so important for everybody.
Now, Dr. Salmon, in April, Israel was able to do something. For the first time in 10 months, you didn't record any COVID-19 related deaths. Have you been able to continue with that? Is that still the situation? Has anything changed?
Well, vaccines are important, actually extremely important, but still you have to take some additional steps. And that mostly concern properly controlling entry to the country. Because the main threat is by the new molecular variants of the virus. And unfortunately, some of them seem to be a bit less sensitive to the vaccines. So we are very much concerned with vaccine resistancy. And of course, when you are able somehow to close issues, and it's not real herd immunity, but create a minimal number of new cases in the country, if you know how to properly control your borders, you could, for quite a while, keep the situation very good. We see even countries like Australia, New Zealand, China, which do not have extremely high numbers of vaccinated, or percentage of vaccinated citizens, but are still coping very well by strongly somehow controlling the borders.
So part of the question was, and I just want you to highlight for me, is Israel still recording any COVID-19 related deaths? Are any people still dying when it comes to COVID-19?
In single digit, it could happen. We still have around 60 individuals which are on ventilators in hospitals. Some of them are in critical condition. So unfortunately, we would see some more cases of this in the near future. But I'm still talking about days with no case of this and days with a single or two cases of this in comparison to a maximum 100 or more in the top of the third wave.
Now, Israel has done quite a lot. I'm just going to quote your health minister here, Yuli Edelstein. He says, "This is a tremendous achievement for the health system and Israeli citizens. Together, we are eradicating the corona virus." But here's the reality. Here in Africa, a lot of countries are running out of these vaccines. In fact, 7 countries have completely run out of vaccines. I know in Israel, you've depended on the Pfizer and BioNTech versions of the vaccines. But have you run out at any point? And if so, how have you coped? How have you managed the situation?
We did not run out because as being a small country, we could plan with the company the exact shipment dates and then plan the parallel campaign in sense of, in one hand, running the campaign and always still leaving some extras. One of the decisions that we have made was to give the second dose exactly as on time by the manufacturer protocols, meaning that we were saving a sufficient amount of doses in order to be able to stand with this principle. Now, in a point, we were able to find some flexibility. If we would know that the shipment is a delay for a single day, we could play a bit. But in no point we had to stop the campaign due to shortage of vaccines. So, again, we are a small country, as you have mentioned. I'm sure that with much larger countries, which are much larger population, which with I would say, a large size of the country, with larger rural areas, these challenges are extremely significant.
So, Dr. Salman, you would put it down to proper planning, which has ensured that Israel has been able to keep up in terms of vaccination. Planning is the key.
Indeed, but it's planning on one hand and then still keeping a sense of flexibility. I'll give you an example. We did create a situation of a standby list for vaccination points, which seems to have some extra doses toward the end of the day. And we would use this system to send on a standby basis first responders like policemen, fire brigades, ambulance driver, etc., which could come in a very short notice, and in that sense to diminish loss of unused doses. So you need some flexibility. So, for instance, we were encouraging everybody to pre-register for an appointment. Officially, you had to pre-register to come. But still, if somebody would queue at the end of the day without pre-registering, we would still vaccinate him. So you have to play this game.
And a very interesting, point you make there. But I also know that Israel has basically been the world's guinea pig when it comes to the pre-trials for the vaccines, and that you pre-ordered some of these vaccines. Is that also accounting for the fact that you've had a stable supply of COVID-19 vaccines? Is it because of the trials that were conducted?
Well, it's not. There was any official trials. The big trials were done. I mean, the phase 3 trials were done in other places, not in Israel. What was in Israel is known to be a post-marketing trial or a phase 4 trial, meaning that now in real life we are testing on millions of people. First, the efficacy of the vaccine, and second, the safety of the vaccine. And that gives an important piece of data to the company, certainly, but also for the entire world in understanding better safety challenges with these vaccines.
Now, here in Ghana, our health minister recently told us that there are 3 entities that are willing to get on board when it comes to vaccine production. I know that in Israel, you've had plans for same to even have homegrown vaccine production. How far have you gone with that? Have you started that drive yet? If not, how soon are you looking at achieving that?
Well, there is an Israeli vaccine. There are two Israeli vaccines now under development, but one is going to start phase 3 trials quite soon. I heard in Argentina and a few other countries. that is a viral vehicle vaccine, in many senses a bit similar to AstraZeneca. And the second effort is to open a vaccine production line in Israel. Now, we are not doing it solely. We are discussing this issue with some friendly countries which have the same challenges as us, and trying to create a kind of an alliance of manufacturing, which you could have an approach in 3 or 4 different countries and then support each other in a day of need. Now, we are not talking only about COVID-19. Hopefully, COVID-19 would be dealt properly quite soon all over the world, and we will see somehow the end of this terrible pandemic. But we have to think ahead, and we must take the lessons for the next pandemic, whether it will happen in a decade or in a century, but we must prepare better than we did for COVID-19.
Doc, how important would you say having this capability, this capacity to produce vaccines is? Today it is COVID-19, but we know viruses keep mutating, the bacteria keep developing, and we could face similar, issues years down the line, a decade down the line. How important is this capacity to produce vaccines for countries across the world?
I think so. I think one of the main lessons is, on one hand, the innovative world was able to produce good products in no time, in few months. That was not presidential. I mean, unbelievable. If you would ask me a year ago or a year and a half ago, is it even possible to imagine that we'll have vaccines in less than a year? I'd say no way. But it happened. But then, of course, we found out that production is a complicated issue. Companies are doing a lot, but it is not enough. I do believe that governments and international organizations as well should go into this issue of proper mass production for the global world.
So very interesting conversation we're having here. Now, let me also just cite this bit because Eyal Leshem, a director at Israel's largest hospital, the Sheba Medical Center, said recently that Israel was close to reaching herd immunity. Now, per the figures I put out before the start of this conversation, you've not got to the 65 to 70% that the World Health Organization says is required for herd immunity. How close is Israel to achieving herd immunity? What are your scientists saying?
Well, I would express my own opinion. I do not think that the term herd immunity is a correct term for COVID-19. It's for various scientific reasons. COVID-19 do not behave like classical herd immunity-related viruses like measles, etc. But I do believe that when you reach a certain point, there is a kind of a semi-herd immunity, in the sense that the disease is pushed down. You would see here or there some cases, but you could go back to normal life. Now, how close we are? So we are now at the 60% figure, and we would, when we'll start vaccinating adolescents, I do believe next month, or maybe even later this month, or the beginning of next month, we would quite soon reach the 70% figure. It is a big challenge to convince parents to come and vaccinate their children, and that would be even a much more complicated challenge when we'll start to vaccinate very young children. Again, there's a lot of anti-vax ideas in the media, and many concerns, and in one hand, of course, people tend to say, well, for children, it is usually a mild disease. We have to answer it in a very honest way. We have to say what we know, we have to admit in what we don't know, and we have to explain in this balance between the risk of the disease and potential risk of vaccines, to show how beneficial is it to indeed vaccinate everybody, including the children. And it's actually going to be our public diplomacy challenge for the next month or two.
Okay, so public diplomacy challenge. It is interesting because I know you have plans of inoculating, vaccinating children aged between 12 and 15. But you've been waiting for the US FDA approval of the drugs for that to happen. Has that approval happened yet for the vaccines?
I can recall.
So could you repeat that?
As much as I can recall, I read that yesterday or the day before, FDA did granted an emergency approval for Pfizer-BioNTech vaccination for 12 and above. And in that sense, our regulatory system would go through the process, which is the one in Israel. It would be a swift process. I do believe that in 2 to 3 weeks, it would be also registered in Israel for 12 and above.
Okay, I'm going to ask you a bit of a sensitive question. COVID-19 is a humanitarian crisis of sorts. We know that in Palestine, some 60,000 doses were received in March, which is pretty small. Is Israel, with all your capabilities and all the feats you're achieving in terms of your population, are you supporting Palestine in any way when it comes to the vaccination drive? And if not, are you willing to do so? Palestine is suffering a lot of losses.
Well, we certainly do so. And it is part of my role, and I'm dealing with issues of COVID-19 with the Palestinians from the first day of this pandemic. Regarding vaccines, we did donate the Palestinians a numerous amounts of vaccines. We actually had vaccinated all Palestinian workers, both ones that are coming into Israel and one which are working at the West Bank. We did vaccinate medical personnel, and we did facilitate and assist with international contracts for the Palestinians. I can't go into details now, but I think in the next few days you would hear about a massive, massive amount of vaccines which are going to very soon enter the West Bank and Gaza Strip.
All right, so to wrap up the conversation, there's a whole lot that Israel is doing. Our leaders are watching, we're all listening, and there's a whole lot that we can also grasp. But what would you say are the takeaways, the lessons that the rest of the world, even the likes of India, can learn from the Israeli example when it comes to technology, when it comes to even, personnel on the ground doing this work? What are the lessons you feel Israel has to give the rest of the world?
I would not speak about technology, but rather about organization. And I do believe that COVID-19 is exactly the situation that should be centrally managed. And actually in federal countries like India, Germany, a few others, it is a big challenge. Second, you need to bring into the table all main stakeholders. I'm talking about, beside Ministry of Health, the police, the military, Ministry of Finance, Ministry of Foreign Affairs, Ministry of Internal Security, ambulance services, hospital management, and many, many others. You must feel that they are part of an properly orchestrated campaign, which is run and held in a very way. Now, then, of course, you need to collect data and IT systems that allow you to do so. I did not go into this issue, but for instance, our COVID-19 vaccination campaign was totally paperless. Everything was done through our central IT system. So despite this, where you got your vaccine, it was immediately registered in the national registries, but at the same time, it would appear at your personal electronic medical record. So that is another issue. And then, of course, again, meticulous planning and commitment, a central commitment of the government to do whatever is needed to reach and to find, I would say, the proper sources to organize what is needed to be organized. And believe me, it is really cost effective. Each of national closure costs much more than, some differences in prices of vaccines.
Well, Dr. Salman, it's been a pleasure having you join us this morning, and we wish you and your country the very best in this drive. We thank you for your time, Dr. Salman. And
I really want to wish Ghana all the best, and I'm sure that the Ghanaian people are going to properly fight this pandemic, and I really hope for a better day for all of us. Thank you.
Thank you once more for your time. Dr. Asher Salman is Director, Department of International Relations at Israel's Ministry of Health. He joined us for that conversation. But when we return, it's all about the National Science and Math Quiz 2021. The regional championships commence today. Reigning champions Presec Legon take on Achimota, Accra Academy, and 10 others in the National Science and Math Quiz 2021 Greater Accra Championships. There's more of that and action on day 2 coming up on the AM show. Do stay.